Got the percentage on that now. Okay.
There's a great need in our time for healthcare. Every person has a right to healthcare because they are a human being. And we know that a large percentage of both Blair and Cambria County are uninsured, and a large percentage, even more, that are underinsured. So with that need, and we have such strong healthcare measures, then it's really a call for us to offer our health services.
This is really great because you have many people from many multidisciplinary functions that have really come together to give a full service screening area so that we can send those folks to get the proper care that they need. We had a guy who could have lost his finger, but it's good that we had this today, because now we can plug them into either Partnering for Health Services or for Primary Health Network. So
well, I think the area is unique in that mostly we want to attract people with poor access, first of all. So if people don't have the ability to access medical care, we want to be there and be a resource to them. So we have tremendous need, and we certainly want to bring access to the individuals who are having difficulty. They're coming here for information as well as advice. So I think gaining their confidence in the medicine works, the lifestyle works, and this is just more education to help them enter into a healthier lifestyle and do the right things for their long-term health.
A lot of good things that I'm not as sick as I thought I was.
Oh, great!
So that's good. Triglyceride, cholesterol, those things are outstanding.
Oh, great!
Yes, that's what I really wanted to check in that aorta. That really, everybody should really get that done. That carotid artery.
Oh yeah, yeah.
That's good. The podiatrist, he told me what to do for the thick toenails.
Okay.
And then I learned my HDL, cholesterol, and all that.
These things are great for screening people and really getting them involved and back into the health system, because right now a lot of them can't afford to get in. A lot of the students now just are doing a lot of in-classroom stuff. This gives them a chance to come out and really make a connection with the people and really see how hard, if they work hard, how the impact they can have on people's lives.
I think this event is important for people in this area because I'm from here, and I know that around this area a lot of people don't necessarily have access to healthcare providers.
Yeah, it's a great opportunity for the school also to just be involved in the community and to kind of bring a little bit of recognition to the majors and what we do up here.
And we all collaborate as a whole, as the health science majors should, because we're all a team, and improving someone's health, it doesn't just start with the doctor, it also includes PAs, PTs, and nurses as well.
Well, it's important because there are so many people in our area and other areas that don't have insurance or are underinsured, and we have the capability and I believe the responsibility as a university to provide this for those individuals who really need it.
There was a gentleman today who came in with pretty severely necrosing finger, and he obviously knew that there was a huge problem with it, but since he doesn't have any insurance or anything, he has been dealing with this problem for the past 3 months, and as we all know, like, necrosing is not something we want to let go for that long. It could spread up to his hand, and he was ready to take matters into his own hands. So it's good that we got him here. He's going to get the help that he needs, and hopefully he won't have to lose his whole finger.
So most of the things we're seeing here is actually preventative. So we're trying to make them aware, trying to engage the patients, to make them see some problems that they can actually be proactive and do themselves and not have to see a physician. But with those people that do have medical problems, we'd like to steer them in the right direction.
every patient I saw today was extremely grateful to be seen today. This health fair is a great idea, and I'm glad to have gotten involved with it.
Now, one of the great things about this whole event was that it's going to grow. More and more people are going to understand that St. Francis is willing to reach out to them, and they're going to come. And so the one thing that I challenge the community on is not to stop, but to continue it on. And sometimes we realize that it may be every time we have an event on campus, it may not meet always our goals that we have in mind. But I think the purpose of this is not to meet our goals, but to meet the goals of God. And the goals of God are that we continue to serve others. And so how we reconfigure or how we work this wonderful event is something that's up to us. But it's something that I think we're called to do by God's call in our own lives.